Hey guys, welcome back to the latest episode of the Growing a Dental Practice podcast. I am your host, Mike Kennan from Patient Boost. In today's episode, I'm joined by Dr. Roslyn Franklin, founder and managing director of Dental Stock Photos. Dental Stock Photos gives dental practices access to thousands of technically correct dental stock photos that have all been photographed under the direction of dentists. Welcome to the show, Roslyn. Thanks for joining me today. How are you?
Good afternoon, Mike. I am well, thank you. I'm talking to you from the west coast of Australia where it's blustery and windy today.
Fantastic. I was about to say, I think you're my first Australian guest.
Lovely.
Which
How
is
exciting.
awesome. Very
Yes.
cool. I've spoken to Brits and I've spoken to Yanks, and yeah, honestly, so good to have you here today. We had a fantastic chat a few weeks ago, and I just couldn't wait to get you on the podcast. So before we talk about dental stock photos, tell me a bit more about you because you are a dentist. So what's your background?
My background is I did practice as a general dentist for 15 years. So I trained at a university in Australia and practiced, as I said, as a general dentist for about 15 years, full-time, part-time. I had some children in that time, so some part-time work. And then I decided to have a break from clinical practice and trained dental assistants, or dental nurses as they're called in the UK, which I thoroughly enjoyed. I love that teaching training side of things, and dental assistants, dental nurses, particularly in Australia, don't have the recognition that they deserve, nor do they have the pay. So I really enjoyed my opportunity to work with them. Then I left dentistry for a couple of years just to have, I suppose, a bit of a break and a reset. And then I had the opportunity to get back into dentistry, but more on a compliance side of things through one of my fellow dentists that I used to work for wanted his practice to become, we have a system here of accreditation, which is voluntary for dental. So I got back into accreditation with this practice, and he said to me, "You obviously love these policies, procedures, and compliance so much, you should do it as a business." And that's when I started my consultancy business, which then branched into infection prevention and control. And that's sort of the area that I've specialized, particularly in dental.
Fantastic.
So
So that's
that,
it. That's in
yeah.
addition. That's in addition to the dental stock photos.
Yes, well, the dental stock photos I only started about a year and a half ago, so it's a relatively new venture.
Yeah.
So I'm
Yeah.
calling upon all my previous experience as a general dentist and then working in infection prevention and control
Yeah.
to ensure that every photo ticks my box and is allowed to be used.
Fantastic. Honestly, it's such a great idea, and obviously we'll cover that in more detail. So that's a bit of background about you. This is the question I ask every dentist. How did you get into dentistry? What was the pull, the driving force? What was it?
You know what? It kind of just fell into it through a bit of exposure. I was at university doing a science degree and heading down one particular path and thought, I don't know if I want to be in a lab. And I was living at a college and I met one of the college. She was doing first or second year dentistry, and we were chatting, and I thought, oh, that sounds like that would tick all my boxes. Quite medical, quite sciencey, using your hands, and I thought, oh, and that wasn't medicine. I knew I didn't want to do medicine. So she got me interested. I had a couple of goes applying and finally got in. And that's sort of how I fell into it. And in particular, I liked the fact that often people could walk in pain and you could more times than not fix it, and they walk out thinking you're the best thing ever since sliced bread because you've taken them out of their pain, or you've cleaned their teeth and they just feel fantastic. So that part of dentistry I thoroughly enjoyed.
I love that. I think dentistry, obviously healthcare as well. One of those. I would say few, but one of those industries or professions where you can actually make a real difference to someone's life. Like
Yes, you
it's
can. Yes.
like a big change, which
Yes.
is fantastic.
Yes, yes, and it can be as simple as smoothing some sort of sharp edge, so they're no longer cutting their tongue. And it's that simple to dentists who, you know, do glam smiles or those veneer makeovers, which for a lot of people, just their confidence blooms when they suddenly have that fantastic smile they've always wanted. Yeah, so yeah, it can be a range of options in dentistry.
Yeah, love that. So it was more the fact that you were introduced by someone. There's no history of dentists in your family?
Absolutely no history whatsoever.
What did,
And
what did the family think when you said, I want to be a dentist?
I remember my dad in particular thinking that was the most fantastic idea. He thought that was awesome. And that was good because it meant I had to do another 4 years at uni. And he was happy to help support the poor student a little longer
Yeah.
because he was gung
Yeah.
ho. Yeah, both my folks were really, yes, very, very pleased. They also said it was a good career for a woman to have because you could work part time. And there's no doubt about it. If you are not, and I was never a gung ho career woman. When I had my children, I sort of wanted to work part time around my children. I didn't want to be a full time mum. That was my choice. And this profession allowed me to do that, which was fantastic.
Awesome. That's brilliant. That's good. I you know, always love hearing, you know, how people get into it.
Yes.
So, because sometimes they look, I'm just thinking, sometimes they look at, they kind of, you can see that their brain ticking over. They're like, why did I get into it?
Yes. Or I was always wanting to be a dentist. I'm like,
Yeah.
okay.
That's fair.
A lot of people get in. A lot of people I know have gone into it for the money here in Australia, but have then had a complete change and go. The fact that they're helping people and in the health profession completely overrode the financial. The main reason that they got into it in the first place, which is good.
Yeah, that's fantastic. So before we talk specifically about dental stock photos, I want to ask you a great question, which is, what is so wrong with most dental stock photography? Like, what's the problem?
Where to begin, Mike? Well, the main issue that I see is the photographs are taken by no one who has any experience in the dental industry whatsoever. So they just pose models, maybe work in a dental surgery, just pose, sit there, hold this, hold that, but they've got no understanding or no concept of how things are actually done in dentistry. Like how a dentist or a dental nurse actually sits on their chairs, how they actually sit around a patient, how they hold their instruments. You will see so many photos, and anyone who's in the dental industry can immediately look at that photo and go, yep, no, we don't do it that way. Because then they might have a closer look and go, oh, they're holding that handpiece upside down. Well, good. And yes, we often have our instruments in our lab coat pocket. That's definitely how we do dentistry. So they're just wrong, inaccurate, cheesy. Can I say a bit American? That's all right. And they're not the credible imageries that the dental practice or dental profession deserves to have. We should be able to go in and get fantastic photos that resonate with us, our patients, and we don't have to worry about them going like, oh yeah, they're okay, they'll do for now, and maybe we'll find something better, but I've never seen anything better.
Yeah.
So
absolutely.
yes.
Like obviously, because obviously, you know, that's one of the. I think that's one of the reasons that I stumbled across your website and across you was, you know, we add, you know, stock photos to our client websites, and yeah, you know, I can tell just having been in dentistry for, you know, a short time that they're wrong. But again, it's like they'll have to do for now until we get, you know, custom photography in. You know, it's funny when you see this, you know, the dentist is now the patient. In certain groups of photos, them wearing jeans under there, which is fantastic, and also a lot of white coats, which I don't think is I'd say probably more like more hospitals.
It seems quite American to be wearing lab coats. I don't know how many dentists in America actually wear lab coats now when they practice dentistry, particularly after all the pandemic that we've had. Australian dentists wear scrubs or gowns over their scrubs, or clinical coats with gowns over, or some sort of coat or PPE. Don't tend to wear a lab coat because it's open-necked and has pockets. And I think in the past, lab coats were the go. I have spoken to dentists who probably worked in the 50s and the 1960s in Australia, and they did wear lab coats, but also they didn't wear gloves. And they used to talk about, barehanded dentistry, and they would wipe their hands on their lab coat. So you'd have blood and all sorts of things on your lab coat. It was kind of like a rite of passage, like the chemist who's the more holes in their lab coat, the more the better. You don't look like a newbie in a chem lab. You've got a burn or a stain.
Yeah.
Yes. So in Australia in particular, lab coats aren't worn by dentists, nor are stethoscopes. I've seen so many photographs. You do a search for dentists and they're wearing stethoscopes.
Yeah.
And I've seen companies make up Canva templates, for dental marketing, and then they've got the dentist wearing a stethoscope. And I did have a conversation once with one of them and said, do you realize dentists don't wear stethoscopes? That's a doctor. If anything, a dentist should be wearing magnification loops. You might see the magnification loops around their neck or wearing them. So that person was adamant the dentist wore stethoscopes. So.
Oh, fantastic.
Okay.
Yeah. Have you ever seen a dental stock photo where the person has got I'm going to balls that name up now, but they're wearing them and then they're using it on the tooth? Have you seen that yet?
Sorry, what were they? What were they having on there?
Stethoscopes. I can't even say it. The scopes.
Oh, a stethoscope.
And they're using it stethoscope, and they're using it on a tooth. No. Have you seen that yet?
No, I haven't, but I wish I would.
Yeah. Oh man, I can't pronounce it. But yeah, I got this picture in my head where they've got them in, and they're literally using them to measure the, I don't know, check the heartbeat of a tooth.
The heartbeat of your tooth.
That would be fantastic.
Your tooth is a living thing, because in the middle of your tooth, if you cut it in half, you'll see blood vessels and nerves, and that's why when things are cold or hot and, you've got a break in your enamel, they hurt because the tooth actually is living inside, but it doesn't have a heartbeat.
It doesn't have a heartbeat. That's one thing you can take away. If you're listening to this and you're a non-dentist, teeth don't have a heartbeat.
Teeth don't have a heartbeat.
That's fantastic. But going back to the lab coat thing, I had several nurses say to me, we would never wear white. Like you don't wear white because that shows the blood stains or the blood splats.
It does, but the thing is, if you do get blood or splatter on your white scrub top or uniform after an appointment with a patient, well, that should be taken off and changed.
Yeah.
So you wouldn't wear it successively. But yes, you can get things splattered, and white can be a little hard to clean.
A bit easier. Yeah.
Yes, and I think a lot of practices these days go for a bit of color in their uniforms. They tend to wear nice purples or blues, or I've seen some in black. That in itself can look quite austere, but yeah, there's a range of choices of colors. You don't actually have to wear white.
Yeah, absolutely. And it's a good opportunity to improve the branding or make the branding of your practice consistent by having the same thing match your logo. That's good. Yeah.
Yes, that's right.
So we talked about why dental stock photos are poor. Why then did you start dental stock photos?
Could I say it was in a period of pandemic madness?
You can say that if that's true.
It was during 2020. I was asked by the Ansell Glove Company to put together a webinar on reopening dental practices, and I was targeting US, UK, and Australian practices. And they said to me, look, hop onto, I think, Shutterstock, whatever images you need for this presentation, let us know, download them, we'll put them in your presentation. I could not find a single photo that was correct. I could find everything that wasn't correct, from, masks under chins to, but just waiting rooms or stereo rooms or surgery. Nothing was right. And I got to the point where I remember thinking, all right. So I dug into some of my photos that I'd taken when I work as an infection prevention and control consultant. I do training and workshops and things, and I often take in-house photos. And I managed to use some of those in-house photos to put into my presentation. And then I thought, well, surely there's got to be somewhere for the person like me at the last minute putting this presentation together can go, oh, I need a photo, and go, where can I buy one now? Because I haven't got time to find a practice tomorrow because the presentation is due like tomorrow. And I thought, right, I've got to do something. I'll do something about this. And initially I thought I would work with a photographer that I knew. Maybe we could go into some dental practice, some of my colleagues, take some photos, and then I could upload and sell them on one of the stock photo company sites. And I approached the photographer I knew, and she said, no, Ros, start your own website instead. I went, okay, let's do it that way. So it's all her fault, Tanita. And that's how it started. So I crash learnt all sorts of stuff with website development and finding a company to do that for me, having the typical experience of a company who promised lots and delivered less, and having to fix websites. But the fantastic thing when I started this project was I've had the most amazing support of my dental colleagues in the areas that I live in, who said, great idea, Ros, open up your practice, bring your photographer in, we set a day, and we'd go in and photograph. We'd either do like a free photography session where as patients came through, you'd ask their permission, they'd sign forms, and we could actually get photographs of treatment happening. And we did that in one of the orthodontic practices. And the staff were like, oh, do you want me to pose do you want me to pause as I wipe down the counter for you to take a photo? So that's how I've amassed just got over 3,000 photos on the site at the moment, with 3
Fantastic.
photographers and the support of my dental colleagues going, come into my practice, go for it. Oh, and in return, I either give them some photos or we take team photos, or some of them want infection control help, so I can help them in turn that way.
Fantastic. Now that's an awesome story. So, like, classic kind of business story where you started a business to solve a problem that you faced. How, between you doing that presentation and realizing there was a problem to launching your business, how long did that take? Like, did you take immediate action, or did you have to mull on it a little bit?
I took probably 6 months. It was 6 months from when I went, aha, I should do this, and started investigating, and then the website launched in the November of 2020. Yes, with the first sort of 1,000 photos that the photographer and I had taken.
Oh,
yeah, so probably 5 or 6 months from the time it was dreamt up. Yes.
Amazing.
And the website's
That's
undergone
really cool.
a few
few changes.
Yes. And if only I knew now, if only I knew then what I knew now. Isn't that the way it is in business? Because you learn so much. I would probably, well, like anything, you'd start it differently and you'd probably have launched it faster. But it's this journey that I'm
Exactly.
on, that, yes, it's up and down and back and forth, but I'm still plowing forward. I'm determined.
Exactly. And it's it's the same for us. Like, everything takes longer than you expect, and you have one idea of what it's going to be like, and then you've like multiple pivots later. Like, that's a classic startup term. We've completely changed. Like, I started as a general marketing company, and now I've specifically focused on dental practices. Like, I didn't see that coming.
Yeah. I never would see dental stock photos coming in a mill either. Yes. Isn't it interesting when you look back and you see those pivotal moments that didn't seem pivotal at the time, but it's only with hindsight you go, yeah, that was a pivotal moment.
Mm-hmm. Absolutely. And everything seems harder at the moment in the time as well, doesn't it? But then you move on to the next challenge, and it's like almost makes everything behind you seem like easy.
Yes, that's exactly right.
Yeah. So other than the fact that obviously it's dental focused. What other things make sort of dental stock photos unique or different from everything else out there?
My main difference is, regardless, well, let's say you've got a graphic designer or you're a marketing company and you've got to build a dental website, but you really don't have any idea about dental photos. What's a good or compliant photo? And you're tired of your dentist rejecting every photo you put on the site. If you come to Dental Stock Photos, any photo on that site, the dentist will tick as, right, that's accurate, that's compliant. So the graphic designer only needs to then look for photos that maybe are portrait or landscape or have the particular model or the coloring or the style or the impact that they want to have. So they can, it's kind of like, right, if I go here, I'm good. And therefore I don't have to spend hours searching anywhere else. So there's a big time saver in that. And the photos they're classified into categories, but broadly, I would say there's the photos for marketing and the photos for teaching and training. So your marketing photos are the smiling, happy kids brushing their teeth, kids playing with big toothbrushes. Then the teaching, training ones can often be those ones that would turn a person's stomach. So they're more designed for dentists if they're giving presentations or if they're going into dental publications and they want more specific photos of, something perhaps a little, might show needles or instruments that turn a lot of people's stomachs. So you can have a bit of variety. So if you want technical or marketing.
Perfect. No, I love that.
Thank you.
That's good. And so if you're in the marketing game, then it's a great way to save that time. So you'll hopefully find the right photo first time and not have to keep going back and forth with your clients. And if you are a dental practice or someone that does training and teaching, then there should be something in there as well. Because I guess that's probably
having trained dental nurses, there's a lot of photos in there about, in the room where they clean and sterilize instruments, and there's certain ways to clean, certain ways to put them in the autoclave and things like that. So I try to bring a lot of those images in, or how to sit properly, how to hold suction properly. So I've been trying to slowly build up that teaching training side as well for those people who want photos to go in their training materials.
Fantastic. I was going to say that's probably an area of sort of stock photos that aren't on the bigger sites, the sort of more clinical ones.
Yes, that would probably be a better term. The marketing photos and the clinical photos. Yes.
Yes. Perfect. You can have that one for free.
Thank you.
So I'd love to get your it's fantastic. I'd love to get your opinion on when should a dental practice use stock photography versus custom photography?
Right. Well, stock photography is fantastic for, as I said, those I need a photo right now. Particularly if you're, for example, if you're doing a lot of social media posts, whether it's Instagram, Facebook, however you do your social media, and you need images quite quickly and you want something specific, stock photography is certainly quick and easy. And you can, search for your photo, register, log in, put it in your cart, pay for it, download it. It's then and there. It's usually emailed to you as a link or sent to you. So you got your photo right away. Stock photography is also good for those clinical photos. If you are doing a presentation and you need a series of photos and you just actually can't get to a practice, and not everyone has the ability or the time to photograph. It takes a lot of time, a lot of effort to take all these photographs, and it's not till you sort of start doing these photographs behind the scenes that you go, oh, there's a lot of work involved in setting up shots, in everything. Custom photography is fantastic for websites, in that I firmly think that a dental practice should have custom photos from their practice on their website, particularly, this is what our practice looks like when you come through the door. Team members, this is our staff, this is what, it looks like in our practice. I think that resonates better with people. I know if I'm looking to go somewhere, I like to see, what does it look like on the outside? Say for a restaurant, what does it look like on the inside? Has it got the ambience I'm after? And so there are definitely times for custom photography, I think, in those sense. And then stock photography fills in the gaps. When custom photography is not an option, or the cost or the time, or you need placeholders, or you just want something now.
Yeah, absolutely. That's a really good. I think that's a really good description or definition of like when you would use the two. So, for instance, when we're doing websites for clients, we will typically start off with stock photography, and then we will encourage them to get a photographer out to take some custom photos, so that I probably wouldn't replace every photo. Not every photo will be custom. Like, I think there's a really good case for like a blend of sort of stock photos and custom.
Yes.
But I think eventually getting around to that custom photography to, like you say, give people a good idea of where they're going, and definitely never use a stock photo for your team. That's obviously weird and probably
Definitely
inappropriate, maybe even illegal to use someone else's face as your own. But yeah, that's great. That's really good, Roslyn. How can people get stock photographies from yourself? Like, what's the process?
It's very simple. You just head to the website, dentalstockphotos.com. And it's just like using Shutterstock, iStock, any of those other major companies. The photos are there. You can search for them. If you have a specific photo you're looking for, you can put in the search terms, or you can browse the various collections. So I have one collection called Smiles. So anything to do with smiling is in there. Other ones with just like waiting rooms, other ones with, there's a section on dogs. I have a Labradoodle and he had to have a starring role, and so did my sister's Labradoodle. And so we got photos of them having their teeth brushed and their teeth, and it's becoming quite popular in Australia as well for practices to have a dental therapy dog. And quite often they're a poodle cross, so they don't shed. And there's a few rules and regulations that you have to keep, but people are very nervous. Well, a lot of people are nervous when they come to the dentist. And to have a gorgeous cavoodle or a poodle cross that looks like a fluffy teddy bear in the waiting room, who's just, most people like dogs. And they're often allowed in the waiting room, and you can pet them and cuddle them, and it's a fantastic icebreaker, helps with the nerves. So those sorts of dental therapy dogs are becoming more popular. I've got a colleague in Perth who has the most gorgeous apricot cavoodle named Benji. And I think a lot of the patients who walk through the door, it's word of mouth. They're like, he's the one with the dog. They don't care about the quality of the work. It's like, he's got the dog. And they're like, I'll be there.
Oh, my word. That's fantastic.
So I wanted
dogs.
to.
That's so good.
Yeah. And so it's very simple. And you just click through, find the photo you want. The photos come automatically with a license called a standard license, which means you can use it in social media, on your websites. If you want to use the photo in a publication or a magazine, you do need to up your license and go for an extended. But it's very simple. You'll see the photo, you'll choose it, you'll add it to cart, choose your license, off you go, go to your cart, check out.
Perfect.
Done.
Easy peasy.
Just flows through. Easy peasy. And they're all royalty free. So it makes it very simple.
Fantastic. Love that. I just can't get over the therapy dogs. That's so cool.
Yes. You'll have to go look at the therapy dog.
Is that an Australian thing, or have you heard about it being in other countries?
I have seen a few American dental practices look at bringing therapy dogs in. And I know therapy dogs are often used in nursing homes or aged care and other places like that. And yes, it's becoming more popular because it's just so, well, if I have a chance to go to a practice and they've got the dog and I can play with it. Some practices will let the dog into the actual surgery room and sometimes on the lap of the patient. It just depends on the practice, the dog, and sort of their regulations. But for some people to have a little fluffy dog on their tummy who just sits there and you can just hug and stroke, Yeah, I'd go there.
Absolutely. I'm just thinking of all the great ways that you could put that into your marketing.
Yes.
Honestly, it's like a no-brainer. Like come to the practice with the cute dog.
With the cute dog. Yes, exactly. Yes. Well, yes, I know my colleague's dog Benji features in their team photo on the home page.
Excellent. I love that. That is so cool. So Roslyn, I'll say thank you so much for giving us an overview of what's wrong with stock photography now, why you're in the industry now, challenging that, which is fantastic. What's next for dental stock photos? Like, what's the bigger picture?
The bigger picture is to continue to grow the image library, as I call it, and I've put out a call for contributing photographers. So I'm on the hunt for any budding or photographer who would like to put their photos on dental stock photos and have the chance to earn a passive commission when the photos sell. So there is a page on the website called Contributing Photographers with all the frequently asked questions and how to apply. So the photos still have to have a theme around dentistry, whether it's oral health, teeth, anything. You can really go to town. And I'd love more animal photos, to be honest. So if you can get anything teeth related with any animal, hey, a bit partial to dogs, but that would be fantastic. I would particularly like before and after photos. I know marketers are often after before and after photos, whether it's Invisalign, braces, implants, veneers, anything along those lines. I would really like to grow the marketing and the clinical side of those before and after photos. But anything that's, people can use their imagination and come at photos with a different angle, whether it's illustrations, clip art, anything like that that's in that oral health dental industry theme would be fantastic. So that is one avenue where I'm growing the business, because you always, even though there's 3,000 photos on there, I'm sure there's photos that aren't there that people want. So let's grow the library so I can have more photos to satisfy more people. And it's great if people from other countries come on board. There'll be a lot more diversity in my photos as well, and that's important. Though I will say every photo before it goes up will be checked by me, and if it doesn't meet my compliance standards, it's not going up. Unless, I was thinking I probably should have a category of correct and incorrect, or something to sort of, because sometimes you want to go, that's a bad photo, but that's the great photo, and that's why, because dentists actually put instruments on a tray. We don't wear them in our pockets. Something is, I don't know, I've got a few thoughts there. So that's one avenue. The second one is custom photography. I've done 2 custom shoots for 2 companies. The last one was for Ansell Healthcare. They provide gloves in the healthcare industry. In particular, they brought out 2 new gloves for dentists, and it was amazing. I had a connection with Ansell in Australia, who then head office in the US went, great, can she take, here's the gloves, we'll give her the gloves. Can she go in and photograph the gloves in use, being used properly? And so they had, it was a custom shoot that I put together with one of my fantastic photographers, Ben, who used to be a destination wedding photographer. He's decided now just to stay in Australia. He's an amazing photographer. So the quality of imagery that we got for Ansell. But then we have to, go to their scope. They wanted no wrinkles in gloves. And that's pretty hard when you put a glove on and then you bend your hand to hold an instrument. You're going to get some wrinkles. So I had to explain.
They didn't want any wrinkles.
They didn't want any wrinkles. And I said, oh, well, we're going to have a few wrinkles because you bend your hand, and you could wear a glove size smaller, which is tighter, but to the trained person, they can go, oh, that glove's too small. And you wouldn't wear a glove too small on your hands for very long, because then your hands absolutely ache. So people who wear gloves all the time, it's the right size, and that's it. So I've did this custom shoot. So I'm now in a position where any dental companies who have products and things, and they actually want them photographed in a practice being used, and then they've got my expertise behind it going, well, actually, in the sterilizing room, this equipment is used like this according to standards guidelines. So then I can get that photographed correctly for them. So we've got that oversight. Yes, so
Fantastic.
those are
So
the two sort of
that's the other
avenues.
avenue.
Yes, that's right.
Fantastic. And I was going to ask you, like, are you planning to get, you know, photos from other countries? Because that would make it, you know, more open and fantastic.
Love to.
Yes. Perfect. Right. Do I know any dental photographers in the UK I can connect you with? I'll have a think.
Okay.
Perfect. Well, Roslyn, this has been absolutely fantastic. Like, I have loved hearing more about your business and obviously your story. Now, based on, you know, your experience of being a dentist and your experience with dealing with dental practice owners, what is the sort of number one piece of advice for anyone thinking about buying or starting a dental practice from your angle?
From my angle, from a dental stock photos angle, it would be
Any angle.
Any angle. Ooh. Well, definitely from my photographic angle, definitely use photos that resonate with, that are real and resonate, and they're not cheesy and stocky and unrealistic. People identify more with real photos, not the I sort of feel a lot of people these days when they go to a dentist's website, they don't necessarily want to see the glamour model with the ultra perfect white smile. They want to see the average person, maybe someone like me, a 50-year-old woman who's just got nice looking teeth, but they're not totally perfect, and they'd be more than happy with that. So from a photo point of view, that would be my one thing. That's really important. From my dentist point of view, what's a good one? I was trying to think earlier. For me, it would be genuine and take the time to listen. And that's also to your staff as well as your patients, and probably more to your staff. Staff and team management is so important in a dental practice to have a fantastic culture, and it does start with the owner or the manager. They're the ones that drive the culture, the team culture. So perhaps even some training in dental practice management, because when I graduated 30 some years ago, we had no dental practice management or people training whatsoever. And it's only as you get older and get more experience that you learn how to interact with various people. And you'll do that as a dentist. You'll have patients from all walks of life, and then you learn how to talk the way they want to be talked to, I suppose. Yes. So probably, just some management skills, but realistic management skills.
No, that's fantastic. Thanks for that, Roslyn. Perfect. So anyone listening, if they want to get in touch with you and learn more about dental stock photos, or even your infection prevention and control business, how can they do that?
So for dental stock photos, just head to dentalstockphotos.com. Everything's on there that you need. Yes, if they're interested in my infection prevention and control consultancy, my business is called amalgamate.com.au. So I did a play on the word amalgam with amalgamate. So sort of policies and procedures and bringing it all together. So that's my other consultancy. Yes. And then, of course, from there, you can reach out via the contact page or LinkedIn. Please connect with me on LinkedIn. You can just
I think that's how we connected, isn't it?
Yeah. Yes, it is.
That's how we connected. Perfect. I will leave all those details in the show notes. But Roslyn, thanks again for your time. Really appreciated it. Love talking with you. And I can't wait to share this episode with the audience.
Oh, thank you, Mike, for the opportunity.
No worries.